I'm Zachary Bloomgarden, clinical professor of medicine in the Division of Endocrinology at Mount Sinai School of Medicine. So the huge issue with type 1 diabetes is hypoglycemia and the need to be really aware of your blood sugar all of the time. And this is not an issue for every person with type 1 diabetes, but there are enough people with type 1 who have serious hypoglycemia that I have recommended for probably about a third or 40% of my type 1 patients that they consider getting continuous glucose monitoring device. And because of insurance reimbursement issues, it's been a difficult sell, although that appears to be improving now. And so I would say that somewhere on the order of 10 or 15% of my type 1 patients currently use continuous glucose monitoring. For some people, it is absolutely marvelous. And they've told me that it's the best thing that ever happened, far better than having a pump, that it truly allows them to know how they're doing all the time. For others, it's not quite as wonderful. It gives you a huge amount of data, and one of the difficulties is that the software packages for accessing and interpreting that data are not really as mature as we'd like them to be. Nevertheless, I think that continuous glucose monitoring represents a really useful advance for many of my type 1 patients. Well, it costs somewhere between $600 and $1,000 to get the CGM unit, and then it costs somewhere on the order of $300 a month to buy the disposable devices that are required to monitor the blood sugar. Until recently, it's been very, very difficult to have patients get reimbursement for those, and many insurance companies have just come back to me and said, "We're sorry, we consider this investigational, and therefore we're not going to pay for it." And I've had lawyers who have type 1 diabetes who've fought with me desperately to get these devices, and we've been stymied. That, it looks like, at least in New York, that's going to change, and that'll be very useful. And if we get more and more favorable articles showing the benefit of continuous glucose monitoring, that will certainly help it to change. Apparently there was a decision by one of the oversight groups that is in charge of reimbursement of blood glucose monitoring, which is mandated in New York State, that such reimbursement be allowed for continuous glucose monitoring as well. Now, I was told about this by a representative of one of the companies, and so this should be taken with a huge, huge piece of salt, not just a grain, but maybe a rock of salt. But if it's true, then it'll be an important way of allowing patients who benefit from it to actually get this device.